Hi there, my name is Mel Hopper Koppelman, and welcome to our show this week. Thank you so much to the American Acupuncture Council for hosting this. This is really wonderful to be here. A little bit about myself, if you don't know who I am, my name again is Mel Hopper Koppelman, and I am an acupuncturist practicing in Rhode Island, and I'm also executive director of a nonprofit organization called Evidence-Based Acupuncture. And so today I want to talk about two areas that are closely related, that are very close to my heart, and that I think if you are an acupuncturist, either just regularly practicing or involved in any way in helping promote the profession, then I think you're going to find this information very valuable. And it's really at the intersection of where evidence meets communication, and how we can use evidence to change hearts and minds about what we do. And so we're going to use the context of the opioid epidemic as a jumping off point to explore this information a little bit. And so I'm guessing that most of you, if not all of you, have heard something about this opioid epidemic. And so I want to go through a little bit of a background about some things that you may not be aware of, but I think are really important for us as healthcare providers to be aware of, so we can educate our patients and also educate the public and medical professionals. So a little bit of background about this epidemic. It's mainly or hit worse in the United States, but also affecting different parts of the world. So this is a visual representation of overdose deaths from, you can see in the upper left-hand corner, going from 1999 down to the right-hand corner of 2015. And the red areas are where there are more than 20 drug overdose deaths per 100,000 people, which is just really a very high number. And here we're looking at drug overdose deaths, not just from prescription opioids, but the two, which is to say prescription opioids and then other drugs. Those two things are going hand in hand and are very closely related. And so as a zoomed in example, this is an area of the United States where there's a lot of workers and a lot of workplace injuries, and we can see a suggestion of what's happening, that people get injured on the job, they go to their doctor and they get prescribed an opioid, and then they become addicted, and then this is associated with a high number of deaths. Here, again, we're looking at the United States, and we're looking at the number of prescriptions for opioids per 100 people, not 100 pain patients, but 100 people. And this is kind of insane. So the numbers really are trending around, at the peak, it's about 81 prescriptions per 100 people. We're seeing that tail down a little bit, but still the effects in terms of deaths and usage are still increasing. And according to the same data set from the Centers for Disease Control in the United States, about 25% of counties in the United States, the number of prescriptions for opioids is 1 for every person. And there was another statistic showing that if there was enough prescriptions to keep every American adult medicated for an entire month. So this is the United States, and I'm not aware of anywhere in the world, has ever seen prescribing of anything like this. Opioids are the #1 prescribed drug in the United States right now, and the proportions, the scale of this is just unfathomable. So a few more numbers that, is looking at that on average, 116 people die every day from opioid-related drug overdoses. It's costing the U.S. economy $504 billion in all sorts of metrics. So that's, emergency room visits, that's disability, this is all sorts of things. And the number of people who are currently having a problem with this is over 2 million. So this is just a huge issue in the United States right now, and again, also spreading to other parts of the world. And also seeing that this trend is at the moment seems to be getting worse. So here we're looking at this trend line from 2000 to 2015. These are total U.S. drug deaths. Again, the marketing of prescription opioids surged this increase in people being addicted to those, and then as availability changes, they go into heroin. And so heroin overdoses are really closely linked to this prescription opioid problem. And so we can see that from 2015 to 2016, even, this number is still sharply increasing. So even though different powers that be are sort of trying maybe a little to scramble around to do something about this, the problem is still looks like it's getting worse before it's going to get better. And we can also see on the right-hand side here that the number of deaths in the United States is higher than the peak of car crash deaths, which was in 1972, the peak of HIV deaths in 1995, and the peak of gun deaths in the United States in 1993. So we've, as a country, we've never seen a problem quite on this scale. And so in 2011, the US Centers for Disease Control declared an opioid epidemic and introduced some guidelines. And actually, some of those have translated to recommending non-pharmacological treatments such as acupuncture, which is something that we want to be aware of. And as I alluded to, that this is not simply an American problem. This is not limited to the United States. This is a figure from 2010 that's showing the opioid dose per capita for each of these countries. So again, this is per capita, not per patient, not per paying patient, but for every adult in the country. And you can see there's this problem extends, U.S., but also Canada, different areas of Europe, and also Australasia, Australia and New Zealand as well. So, given the magnitude of the situation, which I think is still going to take us and the public and the government some time to really wrap their head around. The enormity of the problem is still being understood, but how did this happen is really a reasonable question to ask, and particularly if we want to understand what we can do to help. I think it's helpful to know some of the background about what happened and how this was able to happen. And so, based on different reading, and I was very surprised to learn this, that it really seems like the current situation was created by a single entity, and then others got involved. And this is a pharmaceutical company that's privately owned, based in Stamford, Connecticut, called Purdue Pharma. And coming up to 1995, their blockbuster painkiller was going out of patent, which meant that its profitability would go down, which wasn't very good for numbers. And so they decided that they would create something new. And so they created OxyContin, and the active ingredient is at least twice as powerful as morphine. And morphine and other drugs like this had been used since antiquity in some forms, and particularly with the making of heroin in the 1800s. We'd use these for pain, but it was well known that they were extremely addictive and often fatal. And so they were only reserved for very serious cases, for, let's say, cancer pain, end-stage cancer pain, and things like this. They were not used for aches and pains and that sort of thing. And so the Purdue worked with the FDA, which is the Federal Drug Administration, and got this drug approved in 1995. Now, at that time, there was not a single clinical trial that had been conducted to see if it was safe, if it was addictive, or anything like that. Even though it would have been one would have assumed that it was, because this is like a well-known compound in medicine. But so not only was there not a single trial and it was approved, but the FDA actually approved a package insert for this new drug, saying that it was safer than other painkillers. And the individual who was working at the FDA who oversaw this promptly then left the FDA and took a job at Purdue. And the other thing was that there had been no trials conducted on long-term use. And so what happened here is, so we have this drug that's being used in very specific serious situations, now being marketed as something to take if you have an ache and pain, when there's no real safety data and no data on its long-term use. And so you can see here that in 1996 is when OxyContin started being marketed very heavily to doctors, to hospitals, to these different organizations, and you can see the sharp rise in use. And another thing that happened around this same time was this change. So in any clinical encounter in conventional medicine, it's standard to take vital signs, so to understand what's going on with your patient. And it was proposed that pain was being undertreated, and maybe there was some truth to that, and so that pain should be considered the fifth vital sign. So every patient, pretty much more or less, we should be asking how much pain they're in, and if they're in quite a bit of pain, we should be treating it. And so this led to a huge increase in the treating of pain, when we know as practitioners, a lot of that would have been self-limiting anyways, and maybe didn't need to be treated, and also that we can provide a treatment that's very safe and very effective, and does not have any of the risks that are associated with this treatment. And so the Joint Commission, which in the United States is the organization that accredits almost all hospitals and that sort of thing, in 2001, they put out this information booklet for, I believe it was for doctors, saying some clinicians have inaccurate and exaggerated concerns about OxyContin. This attitude prevails despite the fact there's no evidence. I love this phrase. There is no evidence that addiction is a significant issue when persons are given opioids for pain control. So this organization, this nonprofit organization that's meant to be accrediting and validating hospitals, was in this case funded by the pharmaceutical industry to put out information telling doctors not to worry about safety issues around this drug, even though they're saying there was no evidence that addiction was a problem. Of course there was the history since, even the Romans knew that the poppy leaf was dangerous, but there was also no evidence that it was safe. And so it was, as I said, it was originally only reserved for end-stage cancer pain, but this marketing campaign was promoting it for arthritis and back pain and sports injuries and even fibromyalgia, which are all things that we're excellent at treating safely and effectively. And that these claims of safety that were going out to, what I would say on the whole are well-meaning medical clinicians, they didn't realize that these claims were coming from Purdue's marketing department and not from their science department. So, they were lied to. And so they thought it was safer than it was. And so according to a really interesting article that came out in the New Yorker last year, fairly in-depth, it writes that according to training materials, Purdue instructed sales representatives to assure doctors repeatedly and without any evidence that fewer than 1% of patients who took OxyContin became addicted. So this was a made-up number that came from non-researchers and non-doctors who were educating doctors. So all of this is not a good situation. And again, this is not sort of a complaint fest, but I think it's important for us to understand this story when we're kind of interacting with this patient population, and sometimes many of us are maybe interacting with their local legislators. A lot of them are not aware of this, and so it's really helpful for us to educate them. And so about, just over a decade ago, the Purdue Pharma, the executives were asked to pay a $600 million fine. Nobody went to jail, and $600 million, which may sound like a lot of money and be a lot of money for any of us, is actually a very small percentage of the money they made doing this. And so this is 10 years ago. But if you look at this is an interesting resource. So this comes from a website called ProPublica, Dollars for Docs. And you can actually go onto this website and you can type in the name of a doctor, and it will tell you if they have received any money from the pharmaceutical industry. And that could be being taken out to lunch, that could be taken on a trip, or whatever it is, it'll let you know. But this data that we're looking on this somewhat busy screen is about Purdue Pharma. In the last couple of years, they've paid doctors and hospitals nearly $30 million, with which, the sole purpose of this is to increase their sales. So even though they got fined, this is still going on even now. And so also, so there's the pharmaceutical industries that are making these drugs that are spending money on marketing. And then also on the last slide, we're looking at money going directly to the doctors. And then also now there's new evidence that they do support these patient advocacy groups and professional medical societies. So let's stop and think about this for a moment, that they're supporting, if you're a chronic pain patient or you've been injured on the job and you have these problems, the pharmaceutical industry is funding those groups and telling you that they got your back and trying to help you gain access to their drug. So there's a huge conflict of interest there. And then the professional medical societies, they're meant to be impartially looking through the literature and making evidence-based recommendations, but they are being bankrolled by the pharmaceutical company as well. So as an example, the American Academy of Pain Medicine, the Voice of Pain Medicine, and American Pain Society, which research, education, treatment, advocacy, these guys are funded by Purdue and other makers of opioid medications. And in, what year is this, 2009, these two societies, you can see this as a press release, announced that a prestigious panel of pain management experts representing these organizations has published a comprehensive clinical practice guideline. And they quote, the expert panel concluded that opioid pain medications are safe and effective. But again, they, on the next page, they say, that they're safe and effective, and that's great. And then they go on to say how great that their pain society is, but they nowhere do they mention that they're being funded by the pharmaceutical industry. So again, these stories are starting to come out, but it's helpful for us to be aware of this and understand how it is that this problem got so big. And then in terms of patient advocacy organizations, we have the U.S. Pain Foundation, and they offer hope and inspiration, and they share information and resources, and they advocate for improved care. So they do all of these lofty and wholesome sounding things, but then we look at how they're funded. And Depomed is another pharmaceutical that's one of the top 5 makers of these very often lethal drugs. And so, what we see is that the pharmaceutical industry being able to use its financial resources created what this article is calling a pro-painkiller echo chamber, that they were able to influence policymakers and lobby and do all these things to block any reform to protect patients. And then the other player, of course, is the health insurance companies, and they essentially are making very easy access and coverage for these opioids and not covering or making it more difficult to access safer medications because they're more expensive. And then when we look at the lobby money, this sort of is important for us to understand that the pharmaceutical lobby has spent $880 million influencing government policy. Now, compare that, in the United States, we love, quite a few of us love our guns. That's, 8 times higher than the gun lobby spent. And you can barely on this graph even see that $4 million at the bottom, which was the money being spent on lobbying to protect patients, protect the public from this problem. And so what's helpful to understand here is that we have Purdue Pharma in the United States, but they have a sibling organization called Mundi Pharma, and that's basically their global branch. And so they are set to do the same thing that they've done here abroad, which is first to go in and do studies quantifying the amount of pain that there is in the population, and then saying, your population, loads of pain, loads of people are in pain, but don't worry, we have a solution. And that's what they're planning to do. And I was actually quite surprised when I came across this article in The Lancet, which is a well-respected medical journal called Avoiding Globalization of the Prescription Opioid Epidemic. And what they write, and if something like this has happened before, I'm simply unaware of it. They write that in 2017, 12 members of the U.S. Congress contacted the Director General of the World Health Organization to warn them about this problem, and saying that Purdue Pharma and its global counterpart are basically reckless, greedy, and dangerous, and they're planning to do what they've done here. So to me, I actually got some chills when I read that, because I've just never heard anything like that. But it's helpful for us to be aware, because if we're in the United States, we have a big problem here that we can help solve. And if you're abroad, then you're very well positioned to help with a lot of prevention. There are a lot of people who never be prescribed an opioid for low back pain when it's not even appropriate anyways, and you can offer a real solution. And that's it. We acupuncture, and not just, there are other, non-pharmacological treatments for pain that really do have a place. But acupuncture is very uniquely positioned in terms of what it offers and the evidence for what it can do and how it works to really play a big important role here. And so one document I want to draw your attention to, if you're not aware of it already, is this white paper that was authored at the end of last year. I was a co-author. Dr. David Miller was helpful in that, John McDonald and quite a few others, Jen Stone, putting together all different types of evidence that policymakers, patients, clinicians will want to be aware of in different roles in order to be convinced of acupuncture's benefit. And so what I want to highlight is not just that acupuncture has a lot of evidence, but that there's these different types of evidence, whether it's effectiveness, safety, cost effectiveness, its mechanisms, and so on, that you might want to emphasize depending on who you're speaking with, if that makes sense. So in terms of effectiveness and efficacy, and that all that means is that if something's effective, it just works better than something else that's usually offered, and efficacy refers to these tightly controlled placebo and sham-controlled trials. And acupuncture is effective and efficacious. And so here I'm listing some of the biggest studies that show that, and we can, there's plenty more as well, and I can always contact me at Evidence-Based Acupuncture if you want more links and references if you're preparing something. There's plenty out there, but I want to draw your attention in particular to this study. This is an update of a previous study that's looking at this huge data set of acupuncture for different types of pain, and what they found was that now the data set's even bigger, so it has over 20,000 patients from 39 trials, and acupuncture is superior to sham acupuncture and to no acupuncture for pain. And that also, and I'm not aware of any other treatments that have this data, that it's effective 12 months later. Even after it's been stopped, patients still have effective pain relief. And that's particularly relevant when we look at the fact that the first ever study on the use of opioids for chronic pain, taking it more than 12 months, was published a few months ago. And it found that those who were taking opioids were actually in more pain than those who weren't. I mean, so this is crazy to me. That we can really, by putting those two pieces of information together, we can really make a strong case for helping the public quite a lot. And also putting things together, this is a very helpful study as well. This is looking at comparing acupuncture versus morphine, which is another opioid, in the emergency department where they tested it. And so they were looking at how much pain relief people got and how long it took for them to get the pain relief, comparing acupuncture to IV morphine. And what they found was that acupuncture was more effective than morphine for pain relief, and that also worked faster. Okay, and finally, that it was much safer. So, again, this type of study, there are people who will argue about any sort of study, but if you want to start talking about the placebo effect, then there's really no leg to stand on there. Then you have to ask why the morphine is not as effective as a placebo, which just doesn't make any sense. And also, this is I really quite enjoyed this study, which is looking at expectation, placebo, and nocebo effect on the effectiveness of opioids. And what we're seeing here, I don't really have my pointy bit, but what we're seeing here is that when we have people who are in pain, if they have an opioid and they believe it's going to work, it works really well. But if they're told that it's not going to work, it doesn't work. So, again, we get a lot of criticism by people who don't like the sound of what we're doing, talking about expectation and context and placebo and all of this. But this, placebo effect is a fact of treating humans. That's how we function. So it's not an aspect of acupuncture. It's an aspect of all medicine. And so this is really strong evidence to really demonstrate that. So also we have our safety data, and this again is coming from that white paper that I mentioned a few moments ago. And we have this huge data set of nearly 500,000 patients showing that the serious adverse events were 0.003% of the time. That makes acupuncture one of the safest conditions in modern medicine, and we have the data to back this up. And very to the point, we have studies that show that acupuncture reduces opioid consumption. So there was one study that showed that patients who were given acupuncture following surgery they had a reduced consumption of opioids by more than 60%. So that's huge. So again, we can point to how we can prevent and we can reduce consumption and the need for these opioids. And this was another study that was looking at the same idea. So this is a good reference for you to have as well, that that acupuncture was reducing opioid consumption. Now, some people who you speak to, it may be that the only thing they care about is cost effectiveness, and we have, so we need to point to that as well. And this was taken from a data set in Massachusetts that showed that acupuncture saved insurers, $35,000, $32,000, and so on, depending on the patient population. So if we, knowing that where to get our hands on this information can really help us make the case that it should be covered. And as we know as well, that acupuncture treats addiction. So there was a meta-analysis that showed that it really helped. And, and I think a lot of us will agree that addiction is a complex area. And I think that it needs a number of multi-pronged approaches. So most people, it's not going to necessarily be appropriate to only give them acupuncture. They may need behavioral interventions as well. But acupuncture helps to make the opioid receptors in our brains more sensitive. So it reduces that tolerance that can really help the other things that they're doing. And also, and I think this is a really important thing just for convincing your listener, that we need to be able to point to how it's working, because a lot of our resistance comes from this idea that people think that we're using magical fairy dust to do all of this with acupuncture. But how acupuncture works has really been studied intensely for over 60 years in the West, and we've mapped a lot of these pathways. A lot of them involve our body's own opioid system, and so we know a lot about that as well. And so sometimes, if you're showing evidence that it works, for many people who, if they're a patient or a clinician, that's going to be enough to convince them that it works. But some people are going to hold out until they know how it works, and then we can show them the specific mechanisms. So that was a fairly quick run through of the different types of evidence that we can point to for acupuncture, how it can help our patients, and when thinking about our listener and who we're speaking to, what information that we're going to want to present depending on the case. So definitely download that document that I mentioned. It's available for free. You can go to the Evidence-Based Acupuncture website. We also have a lot of free, fully referenced resources there as well. You can read them so that you can educate yourself. You can send them to patients, send them to your medical colleagues so that they can be aware of this too, and also just know that we are uniquely positioned to really help with this very big problem that's on our hands, and we can really do a lot of good and potentially save a lot of lives. So I hope that was helpful. While I've been chatting, I haven't had my eye on any questions that might have come in, but I'll make sure that I do answer them as soon as we're done here. I strongly encourage you to join us next week. Virginia Duran's going to be speaking. This is at the same time, same place. So please enjoy that. And thank you so much for listening. Please contact me, any questions that you might have, any ways that we can help. And I look forward to hearing from you. And thanks again to the American Acupuncture Council for hosting this wonderful show. Thank you.